Hello, good evening, and how are you? Welcome to another session of Ask the Doctors. It's the Sunday before Christmas, compliments of the season to you and your family. My name is Dr. Funibohari. I'm a licensed medical doctor. On this program, we teach, educate you. We've been here every Sunday for the past 5 years. And I'm glad to have you join me tonight. How are you and where are you watching me from? Talk to me, tell me, where are you watching me from? Happy Sunday. I can see you. Happy Sunday. Tonight we will be talking about gastroenteritis. Anna, I see you understanding gastroenteritis, and I will not be alone. My co-host is Dr. Israel, and he'll be joining us very soon. Anna, I can see you. Good evening. Anna, Liam. Yes, I see you. Good evening. And how are you doing? We'll be discussing gastroenteritis tonight. Before we start, can you tell me what do you understand by gastroenteritis? Have you heard about it before? Tell me, what do you know about gastroenteritis? Oh, yeah, now tell me. And then tell me where you're watching me from. We are streaming live on Facebook. We are live also on YouTube. Wherever you're watching me from, good morning, good afternoon, good evening. Yeah, let's go. No time to waste. Quickly, tell me, what do you understand by gastro? Or, okay, what do you understand by the meaning or by the word gastroenteritis? Tell me. Hmm? And don't forget, tell me where you do watch me from. I can see we have people in the house. Where you do watch me from? Let's go. Peace. Peace. Good evening. Peace. How you day? How your side? Oh yeah now. Let's fire down. Let's fire down. From Lagos. Peach is watching me from Lagos. Okay, my people on YouTube. I can see my YouTube people here. Oh yeah, if you're watching me on YouTube, drop a comment. Yes, I can see you, Mr. Matthew. Matthew from YouTube. You're watching from Lagos. Okay. Mark Angel. Which of the Mark Angel be this? Mark Angel from Wukari Taraba. Okay. Mr. Collins is watching us from Sabungi Daura. Yes, I see you specially. Blessing. Compliments of the season to you from Lagos. Yes, Blessing Aigbedion. How far now, Blessing? And we have Mr. Tunde in the house from Ibadan. Baoni, Mr. Tunde. Okay, let's fire down. You don't hear the word gastroenteritis before. Tell me yes or no. What do you think? Say, oh yeah, now let's go. Let's see whether this in the show. I want to be sure that you can see me. Yes, Mr. Arisco from Cameroon. From Cameroon. Hmm. Okay. Nurse Alex from Taraba. Happy Christmas. Yes, wish you the same. Nurse Alex, how far? Sunday from Ogbomosho. Sunday, how you day? Mr. Chris from Uyo. Special greetings to you. Now, I asked a question. What do you know by gastroenteritis? You don't hear this thing before. Like, listen to me, eh? You don't hear when somebody talks, say, I get gastroenteritis, or you go hospital before, doctor can't tell you, say, you get gastroenteritis. Wait till you think, say, it mean. We won't break them down. You know why? Because this season will be there now, this festive season, a lot of people will come down with gastroenteritis. A lot of, as a matter of fact, some people don't even get gastroenteritis small now. They don't they develop them. You feel me, Abi? So what do you mean? Now, Anna says infection in the stomach or intestine. Oh, you try. Mr. Samuel is watching us from Germany. Madam Taiwo from Canada. How is Germany and how is Canada? What is the time over there? So when you hear the word gastroenteritis, listen, Gastro, gastro. They talk about your stomach and your intestine. So anytime somebody tells you, Oga, you get gastroenteritis, it simply means say this matter now your stomach and your intestine. Nine that they talk about. It means say your stomach and your intestine, they don't get some kind problem. We use the medical word inflammation. So when they get problem, your stomach and your intestine, when they are inflamed, leave it like that, you get small problem. We'll say, you don't get gastroenteritis. And most times, when somebody get gastroenteritis, you get one popular complaint, one popular symptom where they always get, and that is they go they pass watery stool. The person go they shit watery stool. So you go say, I just notice say I don't they go toilet frequently now. I don't enter toilet 3 times today. I don't go toilet 4 times today. E be like say this person don't get gastroenteritis. Yes. And then if you can't notice, as the person gets that watery stool, as they shit water, the person feel they complain of abdominal pain. You hear me? So if he tell you say, belle also they pain me. As belle they pain now, the person feel also tell you say, it be like say my body they hot. I feel I be like say they get fever. These are some of the other symptoms where they follow gastroenteritis. Go tell you say they shit water, belle feel they pain them, body feel they hot, the person feel they vomit. Yes. You they follow me, Abi? The person feel tell you say, I just notice say when I go toilet, go past my stool where they watery. Be like I see blood inside. As they pass water, blood don't dey inside. So these are some of the symptoms where they follow gastroenteritis. You understand this thing where I talk at all? If you understand anything, put am for the comment section. Say, I understand this thing where you talk. Oh yeah, let's go. Sharply. Lydia from Lagos. Madam Lolo, good evening, ma. How are you? Anita is watching me from Lagos. Samuel from Burkina Faso. Hello, Samuel. How is Burkina Faso? Efwa, good evening. Okay, Dr. Israel is here. Make I bring Dr. Israel up. Oh yeah, if you understand all the things where I talk, put on. Dr. Israel, good evening. How you doing?
Good evening. Happy Sunday. And how are you today?
I did fine. Yes, happy Sunday to you. Compliment of the season. Lawal, okay, I understand. Very good. Meaning say I don't break down the meaning of gastroenteritis. For those who don't understand, I tell you where they affect your stomach and your intestine. I tell you the kind of things where they follow them. Don't worry. If you get any question on this topic, we go answer them. Mr. Chris, I don't see your question. No worry. Yes. Dr. Israel, make I allow Dr. Israel give us a little introduction from your own side, and then we'll come enter the reason we make people they get gastroenteritis. Why is it that people they get gastroenteritis? Dr. Israel, do your own introduction, More we work with time.
Okay. Today we decided to talk about gastroenteritis because we notice we don't near we are now within this festive period, and many people will do a lot of chop. Many people will do a lot of things. Some people will even try new things which they never tried before. People will go eat for different places where they never eat before, and things like that. So gastroenteritis now, inflammation or infection of the stomach and the intestine. So when the intestine don't get problem or the stomach don't get problem, that's what we call gastroenteritis. And how we take the notice say person don't get something like this, the person go dey vomit and go dey kaka. And the kaka go be water kaka. Sometimes the kaka fit contain mucus. Sometimes for some people it even contain small red fluid as well. So you go dey vomit. Sometimes you go vomit to the extent say this person no go even fit eat anything. To the extent say they go admit am. So if this thing happen, if gastroenteritis happen to small pikin, it fit lead to their death, for them to kpai, because it's one of the disease wey fit cause, wey fit affect children, wey go lead to them to kpai. So na make e good say we just say make we discuss about am today, small small. No be we no go talk so many things, but we go just talk those part wey dey important to us, so that make we fit live our healthy this period. Make we not come dey enter hospital anyhow for things wey we for fit use our hand prevent. And remember say prevention dey cheaper and dey better than cure. Yeah, mo always remember that. So that is why we dey here today to discuss about am. I don't, Dr. Fred don't give you the definition. I think I just talk small about the definition. So most of the time, gastroenteritis, most of the time, it can be viral infection, and sometimes this thing fit go by itself after 3 days. If you worry person, within 3 days, it fit go by itself. But not before children. We dey talk down adults. For children, even 1 day, 2 day, I bet carry that pikin go hospital. Mostly when you see say yeah, don't they go inside, they don't they weak and all those. In fact, you don't need to make your pikin reach that stage, say don't they weak before that. So what they also advise people that once you don't they get the gastroenteritis, make sure for the adult, make sure say they drink a lot of water. As you the kaka doesn't have water, you try to drink a lot of water. But if you can't be say you they vomit, it means say you not go fit take anything. I better take yourself go hospital, so that they go. Sometimes if you need to pull water through, give you infection and all that to regain your strength. Because the thing not be only say you the kaka water, not be only water you they lose. As you the kaka water and the vomit water, other electrolytes when they our body, it still they affect them. So if you affect them too much, if it cause other problem, which we all need to avoid. So that's why we decided to discuss it. And we also notice that this period, even before the Christmas and everything, we already they notice that some persons they calm down now recently with that stooling and vomiting. And like say don't they many small. So now we say okay, make we still talk on, so that may we learn to take care of ourselves. And another thing is the quick cause and dirty. So when you dirty too much, you go see quick get gastroenteritis. So dirty not good. All those people when they come out from toilet, they enter kitchen, and for children, it still they affect them well. So please make we dey careful, mostly this period. Not just only this period, but more we dey careful what we they eat and how we take they eat and how we take they prepare the meal when we they eat this period. Dr. Fred.
Thank you very much. Make we dey careful with the food where we dey chop, how we dey prepare them, how we dey store them. All these things they're very important. If you never share this video, try share them so that more people go come learn. You understand? The reason why we dey here now to make sure say we prevent so many disease, so many sickness. Now make us dey online to give you this information. Doctor, usually don't talk about some of the things which it cause gastroenteritis. Talk about virus, where they common. And that one again are bacteria. Bacteria they. And all these things, most times, they come from how we take they carry things, put inside our mouths, whether not the food where you chop or not the water where you drink. All these things will affect your stomach and your intestines. And when they affect them like this, the next thing you can notice say the person will they complain, say, if they go shit, water shits. As they shit, water shits, sometimes blood feed the inside. If you vomit, body feel hot, if you tell you say belly they pain them. And as we mentioned before, if you affect pikin where they less than 5 years, if you know they careful, the pikin fit buy. So if you're a parent and you didn't listen to us right now, you need to pay attention to this kind of thing, because we don't see some parents, they go tell you, say, doctor, my pikin they shit water, which I go do, and they go there for house. Before they go realize, say problem don't they enter, this water with the pikin they shit, it don't affect the pikin well. Before they even work out with hospital, the pikin if you don't buy. So we want you to listen carefully, because when person they shit water, it they comot water from your body. And now that water you need to stay alive to sustain yourself. So when you see say, You don't dey shit one, you dey shit second one, you dey shit third one, and the thing dey watery. There's a problem going on somewhere. E be like say you don go chop something wey no good for your system, wey come dey cause you problem. And that thing, if you no address am, problem go dey. We no dey talk about children too much, but the children own be say, if you notice say your pikin dey shit water like this, abeg, the first aid. I don't know whether we go talk about the first aid, the ORS. Should we talk about that or not? I don't know, Dr. Israel. Make we address that one. What do you think?
You're talking because sometimes that one you can even make them for house by yourself. And so I think we can just say that it's not something. It's
Okay.
not something.
Okay. Yeah. So when you see say your pikin dey shit like this water, the first thing we go advise you before you even carry the pikin come hospital, now to give an ORS. That is the first aid, not flagyl. Listen, abeg, no be flagyl be the first aid, no be antibiotics be the first aid. As a parent, I beg you, the first aid wey you go give your pikin for house, now wetin we dey call oral rehydration salt or oral rehydration solution, ORS. If you go any pharmacy, tell them say, oga, abeg o, I need ORS. They go give you the sachet, you go pour am for water, mix and give your pikin drink. No be to go mix antibiotics, because you no know wetin dey cause that thing for the pikin body. And if you go dey give am medicine, you fit worsen the problem. But to keep your pikin alive first, na that ORS your pikin need. And in some cases, when you give this pikin, because we tell you say virus dey cause some of them, the body fit clear and the pikin fit fine. But if you give the pikin this thing, you notice say as you dey give am, nothing, pikin still dey weak, you still dey shit, carry am enter hospital. Dr. Israel, over to you.
Yeah, that now one thing when you feed one, and Dr. Fred don't talk. That ORS, if you want make and you buy them, they get different flavor. They get orange flavor self, and when you feel make and look a bit sweet, it's not like it's really sweet too. So you mix them for 1 liter of water. Yeah, and once you mix them, now only 24 hours it last. So once you mix them by 10 a.m. today, you know say 10 a.m. the next day, which is 24 hours. Now you feel use that one when you miss that moment. So once anyone will remain, you go need to throw it and make a new one. Yeah. So now so that one are for the ORS. And you anytime when the picking shit, you give them the ORS drink. If they ask for water, you give them the ORS drink. This one now picking when be saying now always shit, they shit to you know they vomit to. Because if they vomit, you give them the ORS, you go see vomit. It means say nothing go they stay the body. So once they shit, they vomit, go hospital. And just go hospital because as I said, as they vomit, even though anything when you put for inside the mat, it go come out. So you not go quick that thing take work well for the body. So now let begin when you say now let's shit they shit. And now they give. So when we say gastroenteritis, now combination of two organs, or two yes, two organs, the stomach, which is if we call them gastritis, then the intestine enteritis. So when we put them together, now we can call them gastroenteritis. So most of the time, if now the gastro affect the person, now vomit well. If now the intestine stooling well, now go there happen. So maybe we'll get that time we can call them diarrhea. So it good make you understand these two and these two parts. So as we say, bacteria fit cause and fungi fit cause and that when person don't get low immune system, virus they cause and a virus one they very, very, very common. And so that make we say if you even give only ORS, if na virus they cause before you give them 3 times, if even by itself, stop. Now we'll constantly talk about your cleanliness. So there are risk factors. When we talk about risk factors, now one, your hygiene level. So how you take they prepare your meal? Now you they prepare your meal. 2, those people where they buy food for outside, so they see they at high risk of coming down with this gastroenteritis. Yeah, I get one client when I say last week, that was the only thing we can pinpoint because we ask her, say eat so food. That's okay. You eat so food. People for us eat that same food. He say no.
Mm.
He not fair answer. I can say no. I can say every other person for us still get the same complaint. He say no.
Mm-hmm.
Now only one. I say now only you want eat the food. He say yes. And then the wife when follow can say the food not be house there for cook am. He buy am for outside. Then it was after he finish eating that food. Now wetin he get come dey happen. That's okay. You need to know what you dey buy because everybody will eat for us not be purge. Now only you. Now con dey purge. So wetin you buy for outside is also very important. Be sure that wherever you are buying your food, that they prepare am well, say that they neat in terms of preparing. So if you even dey go buy something and you notice say where they cook and where the pikin for the kaka or where dustbin dey, where they throw their dustbin dey very close, abeg run, no buy food for that place because fly go perch the dirty, e go bring am come the food. And sometimes water when those people go take even wash the things before they come cook am, they not go wash am well. And sometimes our vegetables as well. It's another part when people still take the quick they get this thing. It's because they hear say not let your vegetable too done. That not mean say make you not wash your vegetable very well. And that not mean say make you not wash them very well. So you need to first of all wash it very well before you even think of putting it in the fire and cook it for a short period of time. So your food you need to wash them very well. Those are when they're not they cook. All those fruits when you not need to cook, you need to wash them very well before you eat them. And as you wash them, remember to wash your hand. Hand washing is so important. It's so important in almost every transmissible disease, every disease, like all these kind of cases. Mostly any where stay affect mat for nyash to mat, fikaura. It's so very important because once you wash your hand, you don't break the chain of transmission of disease. That's one thing, one way of breaking chain of transmission. So before you cook, abeg wash your hand. Before you eat, abeg wash your hand. You go use latrine, toilet, abeg wash your hand. You even piss, wash your hand. You sneeze, wash your hand. You not go take anything away from. You not go take anything away from you. And so let's try to learn to dey wash our hand. It is very very important. And one way when we fit prevent this diarrhea. Another way now learn where you dey buy your things and notice where you dey buy your things. Another one now wash your food very well before you cook them. Yes, I know say you say not be fire dey pass through, fire go don kill the germs, fire go don kill. Yeah, not be everything fire fit your kill like that. And sometimes before the fire don't kill them, some of you have don't put them for mat already. Yeah. So that is why it is very important to wash whatever you want cook and eat. Wash them very, 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 very well. And then if you can notice say you can't get gastroenteritis, like, or you can't stool dey vomit. If now always stooling, take a lot of water. If you take a lot of water, you just dey help yourself because now water you dey lose well well. But if you see say man your body not dey be as you like am, abeg go toilet. And the symptoms when they follow am, we talk about purging, vomiting, stomach pain. People complain say their belle dey pain them, say e squeeze them. Say e squeeze them, as e squeeze them, they can't go toilet. Yeah. And some people go come, their body will be hot. Yes. And some people go dey and weakness and general body weakness. The reason why they get the general body weakness because they don't they lose a lot of fluid and a lot of electrolyte come off for their body. So these are now some of the symptoms when some people forget. There are others when if it come happen later, some people kidney fit even shut down because of that. Because water not on the many things the person fit even go unconscious, mostly if now children less than 5 years, they fit go unconscious just from diarrhea alone. Dr. Fred.
Thank you so much. May we take one or two questions and then we go continue. Mr. Chris, they ask us, yes, I understand. Please, can it lead to death? Can gastroenteritis lead to death? Just like waiting Dr. Israel talk, if you notice, you need water for your system, water to move around. And when you get gastroenteritis, you notice that the person go they shit water shit. person go they vomit. And all these things are important in the system. Go they lose electrolytes. If care is not taken, it will affect the kidneys. If care is not taken, kidneys will start to they fail. If care is not taken, the person fit by. So yes, if you don't handle gastroenteritis well, it fits by. And this one, they happen fast for even children where they less than 5 years old. If you know handle and well, the became fit by. For adults, yes, adults fit by, though it no go happen so fast. But when it go happen, they say it go don't cause other problems for the body. Now those other problems will come cause, you understand, the by. So if you know handle them well, the person can actually buy. Hmm? Let's take one more question. It says, let me see this next question here. It says, Dr. Israel, it says, can adults take ORS?
Yeah, the answer is yes. Adults can actually take ORS. ORS is just a rehydration fluid, and it's just a rehydration fluid. So adults can take it. Anybody can take it. Anybody can take it. The reason why we say make up for your picking, because as I earlier said, children had a quick lost all those electrolyte fluid. They lost everything immediately within twinkling of the eyes because they you know, children, they are not big, and so the volume in their body are not much. So a little loss can tempt them to anything. So that's why, as you notice, you quick to address them. But for adults, yes, we big. As Dr. Fred talk, before the thing go even lead to say person come buy from gastroenteritis for adult, it go don't date the person body for a very long time. That's why we can tell you say there's acute case, there's chronic case. Yeah. So you don't date the person body for a long time. So yes, adults can take ORS. And I still the same way when you take make them for the children. Now so you still take make them for the adults. And I see the same principle. Nothing change. Dr. Fred.
Thank you. If you never share this video, share them. This program now, Ask the Doctors program. It'll hold every Sunday by 8 p.m. to 9 p.m. By the grace of God, we don't they do and they come for 5 years, more than 5 years now. So share this video so that more people go learn. The reason why we did here now to teach our people, to break them down for you to understand. Full stop. That is the only reason why we are here. Every other thing, those ones na jara, but that is why we are here. We did discuss gastroenteritis. Now let's talk about prevention. Or no, let's so when somebody gets gastroenteritis, you don't give an ORS for house. You no work. You go carry the person come hospital. When you come hospital, doctor will ask you so many questions. But I noticed that for our people, when you come hospital, you won't make them do a sharp. No, doctor will need to find out what they go on. Go ask some questions. When you ask questions, we can say, okay, this person they shit, they vomit, they will need to give them fluid. Abi? But in that same time, they will need to take some sample, some blood and other things to take tests to know how the person body day. Number one, to find out what they cause the shit. Number two, to find out whether this gastroenteritis it don't they cause another problem for the body. The reason I'm trying to say this is because when you go hospital, you go say, but now only this one carry me come now. Why are you people looking for something else? Like we mentioned, if it cause other problems, if you know handle them well. So your doctor go one check, see what they cause the problem. Okay, this thing, it don't affect the kidney, it don't affect your liver, it don't affect your heart, it don't affect your body. They will won't find out to know how to manage you. And then when they don't know, they will come treat you forward. Okay, Israel, we just discuss some of the ways to prevent, and then we take more questions. Or if you want to highlight some of the management too.
Okay. I think at first, even when I did talk, I mentioned some of the way when you fit prevent coming down with gastroenteritis. So one thing I would advise, because of the period when we did, the festive period when we did, and because most people would like to eat so many things, even what you never eat before, you want to eat them because you see others they eat them. Please, I beg, know what your belly will carry. And first thing. and you know yourself, so you know what you can handle at each time. So not carry go to eat anything when you just see because people they eat and know. Eh? Because it can affect you, it can cause problem for your tummy, it can cause problem for your body, and you go they go, you will start to dey go toilet. And also now it's all those people they eat here, eat here, eat here, eat here, eat here. I beg, try reduce them. Eh? Or you just carry go eat. If there's a way you eat when you feel even upset your stomach, the stomach will just the vest for you to eat like that. Eh? So reduce and just eat normal, just normal every day na normal day. So all this food self when you want overeat now, you dey eat am before. So just eat your normal just eat normally. Na only the aroma dey change, and sometimes the taste fit change small. So just eat normally, and all those too many spices, try reduce am. It doesn't really give you anything. It can actually upset the stomach and cause you problem. Another one na to please abeg wash your hands. I will never, I no fit talk anything without I not put that one join, and that's another way to prevent it. Hand washing. And the third one is hygiene. Before you cook, abeg clean wherever you want for cook. Clean that place. Whatever you want use take cut, clean am. You pick plate from rack. Forget say you wash am the previous night, say e still clean. Please rinse it very well before you use am, because overnight when you dey sleep, you no know wetin waka on top am, and those things fit carry some, dey fit don go waka for dustbin when e dey outside, or dustbin wey you even keep for inside the house, and come use am pass inside your plate, and you don know. You come carry food put on top, and that can cause problem. Yeah. And also abeg, if you eat maybe you eat a particular food, the next day try warm am well before you eat, because some people they carry that one, they give themselves food poisoning, which is part of gastroenteritis. So people fit give themselves that kind of problem as well. So please make sure you cook your food very well, eh? Warm your food very well, uh, make sure your hygiene level is good, so that when we talk about the hygiene, wash where you dey put your where you want for cook, clean after you cook finish, clean am well. Before you use your plate, rinse am, even your spoon. Then once you don cook finish, you not use the spoon again, abeg put am for sink when you wash am before you use am the next day. Because you never can tell what have passed through them. And also please learn to wash your hands before you do anything for kitchen, and after you do everything for kitchen. Please learn to wash your hands, and wash your vegetables, wash your food, and wherever you want for buy food, please be careful where you buy anything, cook food. And these days, not only cook anything these days, just be careful where you buy them. If they are very close to dirty place, abeg try change your customer, or try advise your customer make e dey clean that area, so that make you for no go collect something from outside, carry am enter house. Then when we talk about the management is easy. Just as I said, for adults, you fit not do anything. We just dey take a lot of ORS and fluid. Within 2 to 3 days, it can stop on its own. Because most of the major organism wey dey cause am na virus, and virus sometimes you don't need any drug for it. So you just wait, it go by itself pass for most cases. However, if e come be say e come dey involve say your body dey hot and all that, dey mean say no be.
Yo, wetin happen? Is this from me? Oh yeah, if you know say you dey hear me, please comment. E be like Dr. Israel network don comot. Huh? Okay, so Dr. Israel they talk about wetin you go need to do to prevent gastroenteritis, and also Dr. Israel talk about how did they take manage gastroenteritis. For adults, sometimes you no go need to do anything, but in some cases, you get how you go be. Your doctor fit give you medicine. They will give you antibiotics if na bacterial infection they cause am most times. And then if you don't, they cause you other problems, they fit connect drip. They fit connect drip give you for your body. Okay, now make I take question. Okay, before I continue, if you are a content creator here, there's a code on your screen, a barcode. Scan the barcode, get this course, it will help you. Get the course, that barcode, scan them. Very, very, very important for you so that you no go suffer. You no go cry tomorrow and say, nobody taught me, nobody did this. Whether you are a man, you are a woman, you are a father, you are a mother, you are an elder, you fit learn content creation. Very easy. And I made the video to help you. So and get this course. Yes, it will help you. Okay, now let's continue here. It says here we have a question here from Lolo Blessing. What is the difference between gastroenteritis and teething in children? This is a very good question. Let me start from the first one. No, from the last one, teething. You know the funny thing? In medicine, there is nothing like teething. No. There is nothing like teething. Say, this there's teaching now. Now I make pikin dey sick. No, in all day. I don't know how our mothers, our grandmothers believe say when pikin they get it, pikin must sick. Therefore, na teaching. No, it is not recognized medically. But I noticed that when my pikin they get, I noticed that when my pikin teeth they come out, my pikin they sick. The reason is that for some children, not be every pikin not be every pikin where they get teeth they sick, because your question is the difference between gastroenteritis and teething. Not be every pikin wey get teeth they come out they sick. When the teeth they come out, most times children they like pick a lot of things to put on their mouth. They like the two things to they scratch their mouth. You understand? That's it. In that way, they fit go pick something, put inside their body. And now that thing where they pick, now if you give them problem, they make them sick. So medically, there is nothing like teething. The pikin don't they bring teeth now, go give them medicine. No, because so many children don't get it and they no fall sick. So you cannot compare gastroenteritis and teething with pikin. I don't know whether it makes sense. Gastroenteritis, they different. Now, vomiting, that is go dey purge, if you vomit, if you see blood, but if you hot, pikin fit go pick things put inside him mouth, fit get gastroenteritis too. But no be say na because of the teeth wey dey come out, na im give am gastroenteritis. I don't know whether e clear. Dr. Israel, can you hear me? Welcome back.
Yeah, I can hear you. Sorry, my network just disappeared. I don't know what happened.
Okay, I don't know whether you see this question. You
I
want to talk
expect
anything
this
quickly?
question.
Yes.
I expect the question actually. I expect the question because most people, most mothers or most women, in fact, not just women, most people they get that thing wrong. They think say once the pikin don dey see teeth, he must purge or he must get diarrhea. No, it's not a compulsory thing. And getting teeth is not equivalent to sickness for baby. Now you should also know say by 6 months, children just their immune system just they try to pick up their own personal immune system, just they try to pick up. Yeah, because before that 6 months, now the mother immune system now they help them to do everything. But as that 6 months, some their immune system they try to pick up to carry out the battle by themselves. And you know, because they are children, the immune system now still children, so they don't know anything, they don't know many things. Yeah, so everything fit still affect them as at that time. That's why you need to take care of them. And you know, children when they do their teeth, when teeth they come out, yes, they worry them. You see them they salivate, they go they find where they want scratch their teeth, their mouth put, their gum. Sometimes they feel put them for ground, they do one, they feel put anything for mouth during that period. Sometimes even your hand with the thing, they feel even put them for mouth, they don't even care. They just need to do that their gum so that make it not they irritate them, make it not they scratch them. So during that period, as Dr. Fred talk, they actually can pick a lot of things. And because their immune system still they very minute, their immune system still they try to understand what they happen, then now they make them the first sick. And now they make them the first sick. And so why you not ask why be saying now after that first 2 or 4 teeth they bring, now that they sick reach, after that time they're not going to sick for the other teeth. When they bring out the other teeth, even when pikin come break teeth, they bring out teeth. Why not they sick? Because now still teeth now. So if
If for still sick because they after I don't break teeth, they bring the new one. If for still sick because they bring out teeth. So have you asked yourself why you not going to sick during that time? Eh? So now because most of the time they are still young and they do a lot of things, and that's why you need to watch them and help them.
Thank you, Dr. Israel. When we take another question here, if you just come, we are talking about gastroenteritis. Doctor, I did scan and it showed thickening gastritis. Can it lead to neck pain and indigestion? I took metronidazole for 3 months. Who give you metronidazole for 3 months? Osalobwao. It's getting worse day by day. Please, what should I do? Dr. Israel, I beg, just respond, please.
Okay, and I go advise say make you see a gastroenterologist and doctors when they specialize in the management of anything wey dey affect the intestine and the stomach. Sometimes you may have, it may not even be whatever you dey think. If you say you have there's something wey fit dey make person dey get diarrhea like that or vomit himself like that. There's a syndrome like that that can actually cause that. Or even they make you take medication for a very long time. Sometimes even those medication when you dey take fit even be part of wetin dey give you diarrhea, wetin dey make you dey purge and or vomit. So it's also very important for us to know that. So now make we dey very, you need to still dey very careful the kind of medications when you dey take. You don't take metronidazole for 3 months and you are still having the gastritis. You know say metronidazole not being be the problem. So that's why you need to see a gastroenterologist so that they can actually look at it very well and know what the problem is. Then it go solve them for you. So that means not they waste your money like that.
Thank you. May you know they waste your money. I beg you. Please stop taking this metronidazole for 3 months and follow the advice where Dr. Israel don't give you. I'm having issues with digestive and gastric bloating. What will I take to resolve it? Follow the previous advice given also by Dr. Israel. My guy, please. Oh, yes. Okay, this comment says adults do have gastrointestinal issues too. Yes, Chidima, I think you came late. Chidima, we didn't say that adults cannot have gastrointestinal issues. No, we never said that. Maybe you miss what we talk. The information we say we talk about gastroenteritis, and we talk say if it affect children, if it's serious, well, children less than 5 years, adults will get them too. And we mentioned the symptom, we mentioned what they cause them. Yes. Okay. Let me see. So as we prepare to round up, Pamela, good evening. How are you? Who be this? Doctor, I really like to have a one-on-one talk with you. I'm having also Dr. Israel. You want to comment on this one?
If you must have a one-on-one talk with either me or Dr. Fred, and there's always a channel to do that, and you must pay for consultation. So that's all I can say.
Okay, yes, you've gotten the response. Please, when will you teach about PCOS? I think we have done that before. Maybe we'll do it again. I see your comment, Anna. Okay, now let's try to round up, Dr. Israel. Before we round up, if you know, say you they do content on the internet, go and get my course. It will help you. It will help you. You looking at me, businessman. I see some businessmen on social media that they promote their businesses very well. They are active and they are doing very well. So if you're a businessman, businesswoman, upcoming, and you never they do this kind of thing on the internet, you have to start so that you can make good use of it. But you need to know the do's and the don'ts. You need somebody to guide you. Get my course. Scan this code on your screen. It will help you. Dr. Israel, let's give a brief recap and we round up.
Okay, a brief recap. So today we decided to talk about gastroenteritis because of the period when we did the festive period, and we know say a lot of people are going to take a lot of things this period. So too many enjoyment will do this period. Me and you, we understand. And so many people will decide to eat so many things when they never eat before. eat for places when they never eat before. Sometimes some persons never know where they eat. They just because they see that they eat, they just chook out for any food and be eating. So we need to be very careful and know what we are doing. So we'll also let you know, say gastroenteritis now inflammation or infection of the stomach and the intestine. So when the stomach get issue or the intestine gets issue, we call them gastroenteritis. So because it affects two organs, they affect two organs. I will also mention some of the signs and symptoms when person get when he get gastroenteritis. The ones what we mention are the person go they vomit and go they stew water stew and go they shit water shit. So and that water shit, if they shit more than as many times as possible. Mostly when you shit, if you dey go to toilet once a day, you come notice say you don dey go like more than once a day or more than 3 times a day, that one don dey turn problem, and you come dey water. Sometimes you go dey water, sometimes catarrh fit dey inside, sometimes blood even fit dey inside the stool. While some people go vomit to the ex ten t say the next symptom wey we go talk now come be say the person go come dey very weak. So general body weakness na another sign and symptom. Another one na stomach pain. Some go say the belle dey squeeze them. E squeeze them. As e squeeze them, they can't go toilet. So that one or sometimes they'll say they squeeze them, come make them vomit. So sometimes that one I say another symptom. Some people feel they get fever, their body go dey hot. Their body go dey hot. Some go get headache. Some go get dehydrated. Now that one go mainly happen well for children when they less than 5 years. They'll they dehydrated, even to the extent say they go dey rush for when they see water, they rush and you see their mouth go dey dry. And if you even take them, if that one even can go affect their kidney, they can get kidney problem. If it cause say person go buy, mostly for children of under 5. So that's why it's very important. Say make we if we see our pikin when get any of those things, make we take and go hospital. Because okay, what person will fit do for house before you go take the pikin go or take himself go hospital? Say you can take ORS. And we're actually telling us how we go fit it they make ORS. ORS is oral rehydration solution, and is just a salt and sugar solution. That's the formal name when we call it salt and sugar solution. So you can go to any pharmacy and you will get ORS to buy. When you get them, take and go as mix them with 1 liter of water and start to the drink. And once you notice say you dey stew you dey purge. But if you come be say you dey vomit, it means say anything when you put for mouth, you go vomit. And so for that case, you need to go hospital. So how to prevent these things? Now your hygiene level, because this thing just be like fikaora. What say fikaora? I mean say you from the anus to the mouth. So if hygiene is one way when you fit break that transmission. So hand washing is very important. Wash the food when you dey eat. Mostly those ones where they know they cook, wash them very well before you use plate take food. Please rinse your plate, wash your plate, because you never know wetin go happen. Not just look and say e clean. Please abeg, just rinse am. Even when person dey sell food for you and you just carry the plate, tell am make e rinse the plate again. Not even they tell you say I don rinse am, see am say dey rinse the plate. Yes, so that you will be sure that yes, they really rinse am. Then know where you dey buy food as well. If you notice say where they cook, dey very close to where they dey shit or where the dustbin dey. Abeg, try tell the person, tell that your customer say make it clean the environment, or you just by yourself change customer. And another thing advice is that when you notice any of these things, abeg, try go hospital to take care of yourself. Not eat too much, not eat too much, so that make you not get issue with your intestine and with your stomach. Dr. Fred. You mute yourself.
Yeah, thank you so much, Dr. Israel, for this wonderful recap. Sorry, we did talk about gastroenteritis. So if you ask us any question that is not related to this topic, I'm sorry, we no go respond to you. We are talking about a particular topic today. Apologies. Yeah. This person says, what is the difference between gastrointestinal and cystitis? Ah, uh, I beg, Dr. Israel, if it's the
I don't know how to want to.
I know on the
I don't know how
so
to
so
take really
the question is
that
not,
your
you know,
society.
I
So there
just
are two
think,
different organs. So just
go ahead.
I don't know. There are two different organs. So they don't they don't it's not it's not the same organ. So there are two different organs like that.
Okay. Yes, let me see if we have another question related to the topic. Let me see. Okay, we no get more questions on this topic today. It's obvious that the people where they here, maybe they want to ask something unrelated. Okay, Ikechukwu says always wash your hands before putting anything in your mouth. I agree. Always wash your hands. Yes. Let me see. Let me see. Okay. I'm a victim. Mine is bile reflux gastritis. I don't know if you are here. Bile reflux gastritis. What should I do? I think you should speak with a gastroenterologist. They might want you as well to see a general surgeon if necessary. Yes. Hmm? Okay, I dey check for question. Okay, we no get questions today. Everybody wey dey here, be like most people wan ask about something else, but we believe that we don explain. Now, one other thing wey I need to add, I don't know, when somebody dey shit watery stool, e get wetin we dey always do. We go run buy metronidazole, Flagyl. I don see many people come, doctor, abeg, I need Flagyl, I dey purge. No, Flagyl is not the medicine for purging. No. Like we mentioned before, most times your body go handle the purging as adults. You go purge one, purge two, you go stop. Number two, if for any reason indeed that you need medication to stop purging, Flagyl na antibiotics, not be antibiotics be the first line. There are different things where they cause purging. If it be infection, or if it be something else where they stimulate your stomach, where they make you purge, we they call them osmotic diarrhea. You understand? So you have to be careful. May you not go take Flagyl, you can't go worsen your problem. You can't go develop other complications where you're not supposed to get. So Flagyl is not the medicine for purging. If you are purging, the first thing you need to do is get ORS. If you get diarrhea, if you get watery stool, get ORS. Give your pikin, you take am. And when you don't take am, you no con dey continue, they stop. At that time, you can't need to speak with a professional. Not go drink Flagyl, you will get problem. Okay, Israel, you won't talk anything on this?
No, no, no. And so that you feel you if you get bread, you feel even eat bread, if it still make your stool hard because it will help to absorb the water. Some people feel say you feel drink Gary self, but bread, yeah, bread is okay. Now, for that person when he asked that former question about cystitis and intestinal gastrointestinal this thing, I tried not to say much about it because not being we they talk about. Now I say now two different organs, which that's just it. It's two different organs. One stomach, the other one they talk about bladder, where they piss. So gastrointestinal and the stomach, cystitis, then inflammation of the bladder, urinary bladder. So now two different organs. Yeah.
Okay,
So Dr.
thank
Friend.
you. Yeah,
I
thank
have
you.
to say that many person notice it with girls. we just throw a question like that. We don't want to talk something about them.
Okay, okay. Doc, is lemon good for purging? Lemon. Ah, I never see where person they purge take lemon. No, what be your name? Because I do take it and it's always work. That's why I'm asking. This is a very interesting one. Now, listen, I beg. You know, say lemon, lemon contains vitamin C, ascorbic acid. You know, right? uh Now, when somebody they purge, we dey careful to give them those things wey contain vitamin C, because in some cases, if you also make the person continue to dey purge, get people wey go dey leak. But we also notice that because those lemon too get other things inside, maybe na im dey work for your body. Now, I don't really have this information here. I will go find out. So if it dey work for your body, fine. This is a good one. I no go lie you. This one, me, no. I go find out. I go find out. And if indeed true they work. Remember, somebody feed the purge, you go drink Gary, you go stop him. Somebody feed the purge, you go even chop bread to help him make the purging stop. But for lemon, FY, for lemon, oh no, I never know. I go find out whether lemon they also help with purging. Okay, is there any final words?
My final word for lemon, yes, lemon can actually be used in the management of diarrhea, and also if it still cause diarrhea.
Hmm.
So they work
Hmm.
in two ways. And
Hmm.
because lemon, sometimes they have some antibacterial and anti-inflammatory properties. So because of the antibacterial and anti-inflammatory properties, yes, some research have said that yeah, they can actually help to reduce diarrhea. However, if you take them too much, and they can actually lead to diarrhea. Just like you take your orange, you take your juice, your orange, your no say lemon, something like that. So if you take them too much, it can actually lead to diarrhea. So it's just that two ways, that two things.
As a doctor can also be okay. So my final word is use this medium because the next time we go see go be after Christmas. So Merry Christmas to everybody, and Happy New Year in advance. And we want to say as we celebrate this festive period, let's do it with caution. Let's take everything in a moderate form. Those when they travel, please be careful. Watch everything before you travel. This period, try to dehydrate yourself because the weather is also a bit hot this period. So more try to dehydrate ourselves most of the as continuously because so that we can keep our airway clear, so that catarrh cough no go too affect us this period. So as we enter road, as many people when go to travel, as you enter road, please, as I said, they very careful. And I beg this period not be after now January day, next 2026 January day, and it don't fall down. They look many of us, they smile. So not use all your receipts finish just because you want to celebrate 2 days. Yeah, 2 days, Christmas on the 25th and first of New Year. Because you want to celebrate those 2 days, you use all your resources. And don't not go jam person for road. Those of you now will get motor because you are in haste to gather all the money where you not gather from January till now. And so take care gently. The one when you not gather from January till now, you go physically gather with where you also do it in a moderate form. You don't need to be I think we all understand what they try to talk. So make we just be very careful this period so that we'll be happy in the next year. I will continue this our program. I want to say thank you for always coming to join us from January to this present time. And because of you, I make we day here. If not because of you, I not sure say we for day. I not sure say we for still continue this program. I for say maybe by now we for don't close the door. Say there's no need for ask the doctor. But because you continue to come every Sunday 8 to 9 to listen to us, even when we dey talk things when you not like, because we know want make you do some things, we can't dey talk am for here. You still continue to dey listen to us. And I believe say our talk don't help one or two persons. Nobody go say wetin we dey talk here never help them in one way or the other. And that is the reason why we will continue to the talk. We will continue to give our 1% or our 1 kobo prevention information, so that make we for day healthy. Because health they say is wealth. Health they say is wealth. And for as many persons when they say, oh, Dr. Israel or Dr. Fred, I need your WhatsApp number. Mostly, I think I saw one comment here and say, Dr. Israel, I will need your WhatsApp number. Please, no verse. We know they give numbers. But if you really want to talk to us, you really want to talk to us, it means that you need our consultation. You follow whatever, all the process that you are supposed to follow to be able to talk to us. Yeah. Then we will give you our audience, because we get so many activities when they do. Dr. Fred always they talk that thing. We they busy, so we get many activities when they do. So if we want to squeeze that time for you, you also need to know what to do, so that we can squeeze that time for you. So thank you. I'm not gonna thank you enough for for joining us every Sunday. Thank you so much, Dr. Fred. I think we have done well this year. We'll continue next year.
Yeah, so we thank God for this year and how God helped us, and we thank you too for joining us. We know we take your presence here for granted at all, and like Dr. Israel talk, now they keep us coming here, and we say thank you so much. We wish you a wonderful Christmas and a very very prosperous 2026. Have fun, enjoy yourself with sense. No empty your pockets, no chop anyhow, no do anyhow. Remember, like I always say, good life. Now waiting. Good life. Now saying so take care and see you next week. Bye bye.